Hello everyone, I'm Dr. Harris, and today I'd like to invite you into an important conversation about your heart. You may not realize it, but millions of people are walking around right now with early warning signs of heart failure, and the most concerning part is that many of them have no idea. The human body is incredibly intelligent. It rarely stays silent when something is wrong. Instead, it sends signals, sometimes quiet whispers, other times loud alarms. The tragedy is that we often ignore these messages, brushing them off as normal aging, stress, or just a bad day. But when it comes to heart health, ignoring the signs can be dangerous. Now, let's get one thing clear: heart failure is not a single disease. It is the gradual result of many smaller problems: high blood pressure, diabetes, lifestyle stressors, even smoking or poor diet, slowly wearing down the heart's ability to function. By the time most people finally hear the words, "You have heart failure," their heart has already lost much of its strength. But here is the good news: heart failure is not inevitable. It doesn't have to be the end of the story. If you learn to recognize the early signs, and if you understand the lifestyle choices that either push you toward or protect you from heart failure, you can take action long before serious damage is done. So today, we're going to break this down step by step. I'll share the most common early signs of heart failure, explain what's actually happening inside the body when you experience them, and talk about practical steps you can take to protect yourself. My goal is not to scare you, it's to empower you. Shortness of breath. One of the earliest and most overlooked symptoms is difficulty breathing. Many people notice it first when walking up a hill, climbing a staircase, or even when lying flat in bed at night. The response is usually denial: "I'm just getting older," or "I need to exercise more." But the reality is that shortness of breath may be an early signal that the heart is struggling. Here's why: when the left ventricle of your heart weakens, the powerful chamber responsible for pumping oxygen-rich blood to the body, blood begins to back up into the lungs. The lungs are designed to be filled with air, not fluid. But as fluid builds, the delicate air sacs become waterlogged, making it harder for oxygen to pass into the blood. Imagine trying to breathe through a sponge soaked with water. That's what it feels like when fluid starts filling the lungs. This condition is often called pulmonary edema, and it is one of the hallmarks of early heart failure. Fatigue and weakness. Another very common symptom is persistent tiredness. This isn't the kind of fatigue that comes after a long day of work. This is the kind of fatigue where even small activities, folding laundry, walking across the room, carrying groceries, feel exhausting. The reason is simple: your body runs on oxygen, delivered by blood flow. When the heart cannot pump strongly enough, your muscles and tissues receive less oxygen. Without oxygen, cells produce less energy. And without energy, you feel drained. Over time, this cycle can strip away quality of life. Patients often describe it as running out of gas even when they've hardly done anything at all. Rapid or irregular heartbeat. When oxygen delivery falls, the heart does what it thinks is helpful: it beats faster. This rapid or irregular rhythm, known medically as arrhythmia, is the body's attempt to compensate. But it comes with a cost. A heart that beats too quickly doesn't have enough time to fill properly with blood between contractions. So while it's working harder, it's actually becoming less efficient. The result? More fatigue, more shortness of breath, and often palpitations, that unsettling awareness of your own heartbeat. Chronic cough or wheezing. Because fluid builds up in the lungs, many people develop a persistent cough. Sometimes it's dry, other times it produces frothy mucus, occasionally tinged with blood. This symptom is often dismissed as asthma, allergies, or a lingering cold. But if the real cause is fluid leaking into the airways, then the underlying problem is the heart. Sudden weight gain. One of the most overlooked red flags is rapid weight gain, 2 to 5 pounds in just a few days, without any change in diet. What's happening here is fluid retention. The kidneys play a major role. When the heart can't pump blood efficiently, the kidneys receive less blood flow. The kidneys mistakenly interpret this as dehydration and respond by holding on to salt and water. This leads to swelling, bloating, and that sudden spike on the bathroom scale. Swelling in the legs and ankles. When the right side of the heart begins to weaken, blood backs up into the body instead of moving forward efficiently. This causes swelling, known as edema, in the feet, ankles, and legs. For many patients, this is the moment when they finally realize something is wrong, because the swelling is visible, uncomfortable, and persistent. Nocturia, frequent urination at night. One symptom that surprises many patients is frequent nighttime urination, known as nocturia. You may wonder, what does going to the bathroom at night have to do with my heart? But the connection is very real. Here's why. During the day, gravity pulls fluid down into your legs and feet, especially if you're standing or sitting for long periods. When you lie down at night, that fluid redistributes back into circulation. Suddenly, the kidneys are faced with more blood volume, and they respond by filtering out the excess fluid. The result? Multiple trips to the bathroom at night. Now, occasional nighttime urination may not mean much. But when it becomes persistent, it could be a red flag for advancing heart failure, especially when combined with swelling in the legs or shortness of breath. Orthopnea, trouble breathing when lying flat. Another telling sign is difficulty breathing when lying down. This is called orthopnea. Patients often describe propping themselves up with 2, 3, even 4 pillows, or sleeping in a recliner, just to breathe comfortably. Why does this happen? Again, it comes back to fluid. When you lie flat, fluid that has collected in your body redistributes toward the chest and lungs. For a weakened heart, this is too much pressure. The lungs feel heavy, and breathing becomes difficult. If you notice that you can only sleep comfortably sitting upright, it's time to take this sign very seriously. Reduced exercise tolerance. This is when everyday tasks become overwhelming. Climbing stairs, walking across a room, even carrying groceries can feel like climbing a mountain. This occurs because reduced cardiac output limits oxygen delivery. With less oxygen, muscles produce less energy. As the disease progresses, both the left and right sides of the heart contribute to the problem, the left by reducing circulation, and the right by causing congestion in the veins. The result is a crushing sense of exhaustion from the simplest activities. Abdominal swelling, ascites. Finally, one of the later stage signs is swelling of the abdomen, known as ascites. This happens when fluid builds up in the abdominal cavity due to right-sided heart failure. Patients may notice bloating, loss of appetite, or pressure in the stomach area. It's not just uncomfortable, it's a sign that circulation is seriously compromised. The liver, intestines, and other organs begin to feel the strain. Why does heart failure develop? Now that we've covered the signs, let's talk about the causes. Chronic heart failure often stems from conditions we can influence. The leading cause is high blood pressure, which forces the heart to work overtime for years. Another is previous heart attacks, which damage heart muscle. But here's where lifestyle plays a powerful role. Insulin resistance, type 2 diabetes, obesity, and smoking are among the strongest drivers of heart failure. These are factors we can change. By addressing them early, we can dramatically lower our risk. Other contributors include valve disease, excessive alcohol use, certain medications, toxins, sleep apnea, and lung conditions. So what should you do if you recognize these warning signs? Prevention and intervention come down to 3 pillars: eat better, limit sugar, processed foods, and seed oils. Focus on whole, nutrient-rich foods. Consider supplements if needed, such as omega-3 fatty acids, vitamin D, and nutrients that lower inflammation. Move better. Your body was designed to move. It's not just about gym workouts. It's about walking more, taking stairs, and staying active throughout the day. Movement improves circulation and energizes every system in the body. Feel better. Emotional health matters too. Stress, anxiety, and negative thought patterns put extra strain on the heart. Learning to manage emotions, practicing gratitude, and creating calm in your daily life all protect your heart. Heart failure doesn't happen overnight. It's the result of years of small stresses adding up. But that also means you have time. Time to listen to your body. Time to take small steps that add up to powerful protection. So if you recognize any of these signs, shortness of breath, fatigue, swelling, rapid heartbeat, coughing, sudden weight gain, or any of the others, don't ignore them. Talk to your doctor. Make lifestyle changes. And most importantly, remember, your future heart health is in your hands. Take care of your heart, it takes care of you.